Joshua Yeboah. He's a physiotherapist with the Ghana Physiotherapy Association. And good morning to you,
Good morning.
Joshua. Welcome.
Thank you.
Good to see you. And as I'm sitting here, my back is aching. My waist is also aching. So as you're a physiotherapist and you've come to the studio, you have to do something about it.
Don't worry.
There are many people who are listening who have back aches and waist pains and all kinds of aches and pains all over the place. Is that what physiotherapists deal with?
Yes.
Okay. So it's good that you are here in the studio. Yes. Also in the studio is Ekuya Mantiao. Ekuya is also a physiotherapist with the Ghana Physiotherapy Association. Ekuya, good morning.
Hi, good morning.
How are you doing?
I'm doing fine. I hope you are well too.
I'm not fine.
Oh.
I'm not fine. My back. But it's great to have all of you here in the studio. So, I mean, for those who don't know, can you give us, a proper breakdown of what physiotherapists do or who a physiotherapist is?
Okay. So, a physiotherapist is a healthcare professional that focuses on pain and movement. So, anytime you have difficulty with movement, maybe movement of some part of your body, your back, your neck, any part of your body, a physiotherapist is there to help you. Also, when you have issues with pain, physiotherapists have some pain modalities that they help you with. So anytime you think of pain and you think of difficulty with movement, think of physiotherapy.
Pain and difficulty with movement. Yeah. That's what physiotherapists do.
Yes, that's our focus.
Is it difficult being a physiotherapist? Is it a difficult practice?
I wouldn't say it's difficult. I think it's more fulfilling. It involves a lot, but it's quite fulfilling because when you see the patients that when they first came to you, they were not able to do certain things, but before your therapy session is over, they've been able to achieve their goals. They're able to walk without any pain. You feel a lot of fulfillment from that. So I wouldn't call it difficult.
So what are some of the, of course, you've talked about the things that physiotherapists do, but what are some of the common things or common conditions that people suffer from that would lead them to a physiotherapist eventually, because then it could cause them to have problems, with all the pains and movements and aches and what have you?
Yeah, so we see a myriad of conditions.
Yeah.
So we can take what you call the musculoskeletal conditions. That's
musculoskeletal.
Yeah, so muscles and the skeleton, that's the bone.
We break it down for us. Yeah. So we'll be breaking it down
So
for
when
us.
I say musculoskeletal conditions,
yeah.
I'm talking of anything got to do with your bone, your muscles, and your joints.
Yeah.
So running down from arthritis, sprain, strains, other conditions like rheumatoid arthritis, back pain, knee pain, body pain, waist pain. That is musculoskeletal.
Right.
Then we have the neurological conditions, which are more of this paralysis or sensory issues, strokes, Parkinson's, among many others, multiple sclerosis. Then we have the cardiopulmonary condition. So we have for pulmonary condition, we have lung collapse. That is called atelectasis. So people with pneumonia, congestive heart failure itself, hypertension as well. We also see them. Moreover, in terms of vascular conditions, so we have something called a peripheral vascular disease,
right.
Diabetic foot as well. We attend to them as well.
Wow.
So we also talk of dermatology, that's the skin. So persons with burns as well, we see them. People with lymphedema, swollen foot or hands, we also help them bring down the swelling. Moreover, in terms of pediatrics, that's the children, persons with Erb's palsy, clubfoot, cerebral palsy, we also attend to them as well. Then when you come to the sports field or the sports domain, we are there.
Everywhere.
Yeah, everywhere.
Yeah, we always hear that the athletes need sports physiotherapists.
Yes.
We're always complaining that the national teams don't have physiotherapists for their athletes.
Yes, that's true. And not just the national teams, the other divisions as well,
yeah.
They don't have physiotherapists. So we are quite small in number, and there's a high demand for the profession. Just that we say maybe the focus is not really there.
When you say you are small in number,
yeah,
help us understand that.
So
paint the picture for us.
There are total number of registered physiotherapists or licensed physiotherapists are less than 1,000, the whole Ghana.
For the entire country?
Yes, the entire
country. Population of 34 million.
Yes.
We have only what, 1,000
Yes, less than 1,000. Way less, about 800 and something.
registered physiotherapists?
Yes, practicing here in Ghana. Way less.
Wow.
Yeah,
And I can imagine the workload.
true. The workload is there. And moreover, because people are not aware of our capabilities, so they have some conditions and they just sit down, they don't know that
They have to
it's-
come to a physiotherapist.
Yes. So, for instance, someone may have issues with the balance or the vestibular system. They can't really walk well because they have balance issues, or they have a problem with the ear, which affects their balance. Physiotherapists also play a pivotal role. Recently, I had a case with it was got to do with the jaw, the person's jaw. The person could open the mouth, and they didn't know that physiotherapists also play a role. So I had to attend to the person. I did some techniques, and the jaw was free. Yes, so we do a lot.
I see. I mean, you talked about balance and the ear. So if your ear was cut off, you'd not be able to walk properly.
So it's more of the internal ear system. So
Okay.
we have what you call the cochlea, and they have something called a canalet. It's more like crystals in the ear canal, which helps with the balance and gives perception in balance and coordination as well. So sometimes people may have issues with that. It may get displaced from its normal position. So we have techniques that we do to help send it back to the original position to help with your balance.
So what are some of the lifestyle things that people do on a day-to-day basis, which is not good, if I can describe it like that will eventually land you in the office of a physiotherapist? Things that we do on a daily basis that we take for granted, so as a physiotherapist, you'd advise, about or advise against.
Okay, so the first is posture. You just straightened up.
Yes, I just straightened up.
So usually people assume bad postures without realizing it.
Yeah.
When sitting in office chairs, sometimes they slouch, or when walking, because of using the phone too much, there's something we call text neck. Because you're always on your phone, your neck is always bowed down. So that will also cause you to need a physiotherapist at some point.
Text neck.
Yes, text neck. Then also using the computer for long hours, sitting down without breaks. Ideally, after 40 minutes to an hour, you should take a 5 minutes break, walk around, stretch, break that cycle of continuous sitting. Else, you will need a physiotherapist at some point. Sedentary lifestyle, so not doing much. You go to work, you sit the whole day, you come home, you lie down, you don't do any exercise. You would need a physiotherapist at some point in your life, because
What does that do to you, the sedentary lifestyle? Because a lot of people seem to be living that. You are sitting in long hours of traffic in your car. You get to the office, you only walk a few meters. You walk for about 1 minute. You get to your office, you sit down. The whole day you are sitting down behind a computer. You only move around 1 or 2 times. You sit in long traffic again to get home. And then when you get home, you are sitting down, watching TV, and then you fall asleep. That's a sedentary lifestyle, right?
Yeah.
What is the danger of that?
So the danger of it is hypertension. It puts you at risk of getting high blood pressure, and also high cholesterol, and obesity, and even some cancers. Diabetes as well. Like, there's so many things that being sedentary puts you at risk of. So that is why physiotherapists are preachers of exercise. Physiotherapists will always, you can never go and see a physiotherapist without being given an exercise. A physiotherapist will always tell you to exercise, because an exercise helps prevent a lot of these conditions I've mentioned, and they also help treat a lot of the conditions too. So yeah, that's it.
So people are not exercising enough.
At all.
So how many times should people, because I've heard this, some say exercise every day. Some say, exercise for 30 minutes 3 times a week is fine. Some say 4 times a week. What is the ideal,
So ideal is every day, and moreover, we have different types of exercises. So we have the flexibility exercises. So that's more of stretches. It's an exercise. We have muscle strengthening is one. Then we have the endurance training.
Yeah.
We also have balance and coordination training as well. So it varies. And some for musculoskeletal conditions, specifically low back pain, or
I'm trying to change my question.
specifically low back pain, or other spinal conditions, stretches is very good. So I don't know. Do you have a pet at home?
I don't, unfortunately.
Wow.
Yeah, I don't have a pet.
But which animal do you prefer, cat or dog?
Different. Any of them is fine.
I see.
Yeah, any of them.
But have you taken your time to observe a cat or a dog around?
Yeah.
Good. You notice that they like stretching a lot.
Yes.
Good. The reason is because they are mammals, and according to biology, we are also mammals, so we have a similar structures as well. And you realize that they stretch a lot. The reason why they have to stretch constantly or every day is because of the way the muscles are. So, and then the fascia. So every day when you stretch, you are improving the joint integrity as well, and then the muscle health itself. So if you don't stretch over time,
Yeah.
and we begin to have a lot of tension and restrictions in the joint, which affects and causes pain in the body. So that's why you have to stretch
So
every
you should
day.
be so what is the stretching? Because usually when people wake up in the morning and then they sit on their bed and they raise up their hands and then they will do the or when they
Chest
sit for a
out
long
and
time
yeah.
they will do the chest out with their arms out, like I'm doing for those of you who are watching on Facebook Live, and then they make a sound, they do
Yeah. So that's a good
and
stretch.
then they say that how do they even say it or chinimu?
Or chinimu, yes.
So is that a stretch you are talking about?
Yes, yes.
So you have to
Yes,
Okay,
that
I'm-
one alone is part.
Okay.
And we have different kinds of stretches. And when we talk of exercises, you don't necessarily have to go to the gym to go and exercise.
Right.
As I'm sitting down here with you, I can be exercising as well. So as simple as just sending my tummy in, sustaining it for about 10 counts, and I release alone.
Oh really? That is
Yes,
exercise.
That's exercise. And also helps with low back.
So hammer.
Yeah,
Oh ham.
yes.
The ladies do it a lot when they don't want their hot bellies to show.
Yeah, so they are also
when
exercising
they
as
don't want
well.
their hot bellies to show.
Yeah.
They,
So it is sometimes with low back pain, sometimes based on my physical assessment, whilst the
Yeah.
person is standing and I'm monitoring the alignments as well,
yeah.
sometimes you realize that the pelvic is tilted in front, which is placing a lot of pressure or tension at the lower back. So sometimes I just tell them that just send your tummy in a little and let's see if the tension or the pressure reduces. When they send it in, they realize that it drops.
Okay.
So I tell them that, you see, this also infers that their abdominal muscles or their core muscles is very weak. So just training that alone also helps stabilize the spine as well.
I see. You also mentioned slouching, which is also very common,
Yes.
right? People slouch a lot. I mean, I'm guilty of this. You know, you sit in a chair and then you sit in a particular. What is the danger of slouching?
Okay, so the danger of slouching is you have a constant axial pressure, that's downwards pressure, acting. So we're going to do a little physics over here.
Okay.
So for my little SHS or primary school education, pressure is force over area. And then one thing we should know is that gravity is the force acting constantly. So assuming gravity is 10, and you have individual spinal vertebra, that's the individual bones. So gravity times, assuming your spinal bone is about, let's say, 10. So 10 times 10 is going to be 100 newtons. That's the force. So you multiply that. So you have something called the resultant force. So we have the first spinal vertebra.
I feel like you
second-
start playing the national science and maths quiz sound for you. Because this one is problem of the day.
Yes. So the first one, second one, third one, all the way downwards. So they usually center at the lower back. So
Right.
when you sit for long, you slouch. Initially, when you slouch, it feels good a little.
Yeah.
The reason why it feels good is because you are changing the dynamics on the spine in terms of the force dissipation. So when you slouch, initially it feels good, but over a long period of time, what's happening is that the pressure is constant, acting downwards on the spine. That's axial. And then in such cases, what you can have is you may have issues with the disc, because the disc, it has a fluid component and has a fibrous
The
component.
disc, where's the disc?
So in between the two bones, the vertebral bones,
Okay.
yes, it
Right.
acts as cushion.
Where your spinal cord is.
So,
Or where is it?
so the spinal cord is in the
It's
vertebra.
inside the vertebra.
Yes.
And then the bone, the backbone.
Yes. So let me explain it. So
Okay.
the backbone itself
Yes.
is the spinal vertebra.
Yes.
So it has about 33 bones.
Okay.
Yes. And inside, at a certain
Inside
point,
is the spinal
yes,
cord.
That's where the spinal cord is.
Is that what? So, and the discs are
In between.
in between.
In between
So
the
like
bone.
the joints, the one which
Yes.
joins. So
Yes.
those are the discs.
Good.
Okay.
Good.
Good.
Are
Yes,
in
yes.
between. So what
We are
happens is
learning
that
science.
because of the fluid component, so it's the disc is able to move or bulge a little bit. So once you bend in front, it's like a balloon that you've tied at the end and you press. You realize that when you press down, the balloon sort of spreads around
Yeah.
evenly. So that's what's happening. So imagine slouching. You slouch in that position, a balloon spreads evenly. So slouching causes you to flex. That's bending in front. So it pushes a little backwards. So by so doing, over a long period of time, you are making the disc bulge, which is one of the commonest among the specific lumbar conditions.
Right.
So over time, you end up pressing against the spinal nerves, depending on how you sit. If you are on the right side, you most likely press the spinal nerve on the right side. If you're on the left side, you most likely press it on the left side. Over time as well, you can also end up pressing against the spinal cord itself. That's when you have some sensations in the legs, which sometimes can affect sexual function, walking, among many others.
Wow.
Yeah.
Slouching too much can lead to that.
Yes, that's the advanced, the advanced cases.
Right.
Yeah. So over time, because there's constant pressure acting downwards, there's irritation in the joint itself, and that begins to cause arthritic changes. So arthritis is not just the wearing and tearing; it's more of an inflammatory response in the body. So you cause that inflammation over time. You begin to have these arthritic changes. That's where you have the spondylosis, and at the same time, as you slouch, for some people who have osteoporosis, that's the bone strength has reduced over time, they may end up getting vertebral compression fractures. So the fracture is more or less like a collapse of the spine. Yeah, so that's why sometimes we urge people not to slouch too much. So especially my clients who are above 65 years, and more specifically the ladies, when they are about 45 years, I always tell them to monitor their calcium level, vitamin D levels as well. And moreover, because they are at risk of osteoporosis, certain postures that they assume can also end up affecting the spine.
Right. That's so slouching is bad.
Yes. So the thing
So
is,
how do you? So people have slouched for a long time, and their posture has changed. What about that? Is that dangerous, or should people whose posture has changed, maybe they are bent a little forwards? Maybe sometimes you see a lot of people who are sort of like looking like a hunchback,
Yeah.
really bent. Maybe their necks coming out and
Yeah.
all of that, and that's the posture that they've had for a very long time. Is there any danger in that? Should people like that be taking steps to try and correct their posture?
Yes, please. There's danger in that. So, yes, you should take steps in correcting it. First, see a physiotherapist who will do a postural assessment for you and tell you what you need to do, give you certain exercises you can do to help better your posture.
Right.
Because the danger is that once you get old, these things that were not causing pain when you were younger would start causing pain. Then you would need a physiotherapist. And most of these things is management. You would have to manage it till
you drop.
you drop.
Wow.
Yes, so you'd have to put steps in place. So sometimes we can even recommend you get a back brace to help you. For people who it's so bad that they can't actively do it themselves, they wear a back brace like a school bag to help them chest out much better. That posture is called kyphosis,
Right.
hyperkyphosis. So when you look at the spine, it curves in various ways. So from the neck, it goes in. So that's called lordosis. Then it comes out at the back, like the thoracic region. That's kyphosis. Then the lower back region is also lordosis. Then the last bones is also kyphotic. But people, because
A
of
lot
the
of technical terms this
Yes.
morning.
But because of the postures people assume, all these curves become exaggerated.
Right.
So then people become hyperkyphotic like this. Then people become hyperlordotic, especially the women with the very big buttocks. So if you are going,
And that's why they always have waist problems.
yes, you end up so
Big
if-
breast as well.
Yes, big breast as well also puts you
Right.
at risk of back pain. So
So what do those people do? Should they reduce it? Should they do surgery and reduce it?
I don't think
How
it
do they do it?
so if you don't have
Because there are people who are extremely endowed in front, extremely endowed at the back, and it's causing all kinds of problems.
Yeah.
So, what are the remedies
so that
for
there are
people
people
like that?
who go for surgery for breast reduction surgery
Yeah.
because their breast is way too heavy than they can manage, they can carry. And then for those who are very heavy down there,
Yeah.
a way we can do liposuction to add on, you can also do that to take away
take
some
some
of
out.
but most ladies
Yeah,
don't
they
want
like
that.
it.
Yes. So the best thing to do is to add exercise to your regimen so that in as much as you have that lordosis, that hyperlordosis, you can be pain-free.
All right.
Yeah.
So we'll talk a little bit about back pain, but before that, what about sleeping position? Does it matter how you sleep, or the kind of position that you sleep on your bed, sleeping on your tummy, sleeping on your side, sleeping on your back?
It does.
Does it matter?
It does.
So there's a proper way to sleep,
Yes, but it's
or a proper sleeping position?
yes. So it depends on the position you find yourself in. So, for instance, if you are to lie face up, it's ideal for the lower back to place a pillow, a highly dense pillow, behind your knees. So when you place the pillow behind the knees, it causes a knee flexion and a little hip flexion. That's bending towards you. And by so doing, you relieve the lower back of the pressure
Really?
Yes.
So if you are sleeping on your back, you have to put a pillow under your knees.
Yes.
Wow.
Yes. And also, the pillow that you need for your neck and head should be a little light. So when you lie on your side, so you are supposed to get about 3 pillows, but 2 can be okay. So the thick one goes to the head and neck region, and then one in between your thighs, and then you can have a very light one that's around the rib area. To also, so the whole idea is when
So you shouldn't be sleeping with one pillow.
yes, you shouldn't be sleeping one
So
pillow.
those of us who have one pillow,
Buy more, buy more.
You have to buy more.
hey, really?
Yes.
I thought one pillow was enough. Oh.
Oh no, it's not enough. It's not enough.
So I need to buy more pillows.
Yes, buy more pillow.
Wow. Okay. So if you are sleeping on your side, you need more than one pillow, right?
Yes.
Probably because of the distance between your
The
head
shoulder and then the
resting
head.
and then the
Yes.
shoulder, so that it doesn't. And then you have to put another pillow in between your
Thighs.
thighs.
Yes.
If you are sleeping on your side,
Yes.
and another one way,
Around the rib area.
Around the rib area.
Yeah, from the rib towards the lower back.
but that's a flatter one.
Yeah, much flatter one.
Wow.
So especially those who are very curvy. The reason why you have to place the pillow there is because of the curve. So
Okay.
ideally, if I'm to stand behind,
So for the women who are very careful,
Yes.
For we the men who are straight there, we don't.
yeah,
we don't
you
we
may
don't
need
it.
just a flatter one, but the ladies may need much thicker ones around that area.
Okay. Wow. I didn't know this. I'm sure a lot of people didn't know this as well.
Yes.
Okay. So if you are sleeping on your back, you should have a light pillow. You should place a pillow under your knees if you are sleeping on your back.
No, sleeping on your back, the light one goes to your head
To
and
your
neck.
head and
Yes,
neck.
your head and
And
neck.
then you have to place another one
Yes.
under your knees.
The one under the knee is the thicker one.
The thicker one under
Yes.
your knees.
Yes.
And then if you sleep on your side,
Yes.
2 pillows for your head,
Yes.
one in between your thighs,
Yeah.
and a light one for your waist
Yes.
area.
Yeah, but the 2 pillows, you can, if you have a thicker one which can match the 2 pillow size,
Okay.
then it's okay.
So we've been sleeping wrong all this while.
Yes.
Ah. So what about sleeping face down on your belly?
Yeah, so sleeping face down, you get a much thicker pillow around your groin area. So you just
Okay.
place it there and then you can lie down flat.
Wow.
Yeah.
Also with a pillow
Yes.
on your head side.
So the pillow on the head side should be very flat.
Okay.
Yeah.
Wow. Okay. We've learned something this morning. Let's talk about lower back pain. Lower back pain. Who and who can get lower back pain? Me, I have upper back pain.
everyone
And lower
can
back
get
pain.
everyone can get
Yeah.
spinal pain.
Yeah.
Everyone, no age is limited.
So, what are some? So, we've already talked about some of the risk factors of low back pain, right?
Yes.
Can we stress on that again? Because a lot of people seem to have that, especially those who are, advancing in age.
So some of the risk factors of low back pain include sedentary lifestyle.
Yeah, that we talked about.
Obesity, because the heavier you are, the more forces act on you. So then your low back is the one bearing all that weight. So for people who are obese, would usually advise that they try reduce their weight. And in fact, aside the low back pain bearing all the weight, your knees also suffer at some point. So in as much as you can, try and manage and control your weight. Then people who also do a lot of manual labor, like masons, painters, carpenters, people who do work that involve carrying heavy stuff.
Yeah.
Sometimes they assume wrong postures when carrying items. Ideally, you should not bend down, like just flex forward and carry the thing. You should step, one leg should be in front of the other. Then you bend your knees as if you are squatting. Then you carry the thing that you are carrying. And as much as possible, to try and get help, because it reduces the stress or the strain that's going through you.
So,
Pregnant women are also at risk
Okay.
of low back pain.
Okay.
So because of the bulging in front of the baby, it weakens their core. And then once your core is weak, it means all the forces are now acting at your back. So it puts your back at risk of getting low back pain. Men who have pot bellies, like heavy pot bellies,
Yeah.
also have risk.
one round pack.
Yes.
Yeah.
They are also
They
at
say it's a flex now if
It's-
you have a pot belly.
It should not
Oh,
be
no,
a
no,
flex.
It means you are zaddy.
Hey,
Zaddy.
zaddy.
Yeah, zaddy.
It should not be a flex. They should also try and work on it because it will put a lot of strain on their back.
Also, prolonged use of steroids as well also places your back as a risk. Not just the back, your joints and then the bones itself as well. People who take alcohol a lot on the regular. They have that issue as well. People take a lot of caffeine as well.
Mm-hmm.
So dietary factors are part. So if you don't eat well as well, your
Caffeine. So are we talking about coffee?
yeah,
Are we talking about energy drinks?
true. So those who take a lot. So usually when you take more than about 3 in a week, yeah,
Wow.
so yeah.
There are people who drink coffee every day.
Yeah, so the coffee it has a little amount. So we have some of these energy drinks.
Okay,
as
the
well.
energy drinks. I know somebody who drinks energy drinks every day.
Every day.
Every single day.
Wow. So in the long run, so usually this kind of stuff, it doesn't occur just maybe within a very
Within a short
period of
time. You don't
yeah.
notice it now.
Yes,
It's
over
long
a
term.
long period of time. And so sometimes people who are on steroids, and maybe because of their medical condition, so in as much as yes, they are on steroid, they have to see the physiotherapist as well to help strengthen the bone and to help the bone, the what you call the osteoblastic activity. So osteoblastic activity is more or less the activities in the body that also helps in the bone formation as well. So every human being, you have something called the osteoclastic activity and then osteoblastic. So one part of your body is taken away from you. I'm just trying to summarize it for the layperson. And then the osteoblastic is more or less trying to add on and to build on the strength. So it's always happening every day. But as you age as well, what happens is that the one that takes away, it becomes more than the rate at which the one that is able to add.
Right.
Yes. Okay.
Interesting. So, I mean, are there any home remedies for relieving lower back pain
So
when you have it?
okay, low back pain, there can be a lot of factors that causes low back pain. So you'd first have to see a physiotherapist so that they can be sure what exactly is the cause. Some low back pains can come out as a result of referred pain. Referred pain is when there's an organ, an internal organ that is referring pain to another part of your body. So some people will be there, they'll be feeling pain in their chest, in their left arm. That's usually the heart. Yes. Or people will be there feeling pain at their lower back. It could also be the kidney. Maybe you have kidney stones or
Appendicitis, a lot of conditions
yes.
as well.
So you need to take note of these.
Yes, you first come to a physio, then he would assess you, then he will screen you and see if it is maybe something
more of a systemic condition.
or something that he would have to refer to another specialist to take care of. Then from there we can know that okay, we'll plan these exercises for you, or you should do this, you shouldn't do this, that kind of thing.
Okay.
Yeah.
Okay. All right. So finally, let's get to World Physiotherapy Day. Tell us about World Physiotherapy Day.
So World Physiotherapy Day is celebrated on the 8th of September of every year since 1996.
Wow.
The World Confederation of Physical Therapists were the ones who brought about this day. So this day is to celebrate physiotherapists all around. And it helps physiotherapists come together to sort of show themselves to the world, to show themselves to the public, to educate the public on what physiotherapists do, how physiotherapists can help, and so on. And usually every institution and whatever they have planned for World Physiotherapy Day, just the whole idea is to sensitize the public about physiotherapy and then the theme for the year. So every year there's a new theme that we talk about. So this year is low back pain.
Low back pain.
Yes. So every year there's something that we educate the public about as World Physiotherapy Day.
So what are the activities lined up for World Physiotherapy Day this time around with the low back pain? Are there some free massages available?
So we are having outreaches planned out as well.
Yeah.
Tomorrow we are having a public lecture.
Okay.
As well, which is free to the public. We're inviting everyone to come and join and partake of the public lecture.
Where is it happening?
At the British Council.
Okay.
Yeah, 5 p.m.
British Council.
Yes.
At 5 p.m.
Yeah,
Or 4 p.m. Okay, 4 p.m. at the British Council.
Yes.
Tomorrow.
Tomorrow.
There's a lecture, public lecture on
Yes.
physiotherapy.
Yes, and when the public, when it's open to all, when you come, you see other physiotherapists, other specialists as well, where you can also discuss with them some of your conditions or your problems, and you learn a lot about physiotherapy.
Okay. All right. Thank you very much, gentlemen, for joining us in the studio. Gentleman and lady for joining us in the studio today. Ekuya Mantiao, thank you very much for coming.
Thank you.
And Joshua Yeboah, thank you very much for coming as well.
Thank you.
Physiotherapists are doing a lot. So tomorrow, I mean, on the what? On the 8th, right? On the
Yes.
8th, that's not tomorrow. That's
Sunday.
that's Sunday. So on the 8th at the British
No,
Council
tomorrow is because of the event is on the weekend.
on the weekend.
Yeah, we've brought it to Friday. That's
Okay.
today.
Okay.
That's
All
So
right.
that's tomorrow.
That's tomorrow.
Yeah.
Okay. Very well. So tomorrow at the British Council at 4 p.m.
Yes.
public lecture. It's free.
Free. Open to all.
Open to all. We shall be there.
Okay.
All right. Thank you very much for coming.
You're welcome.
Thank you too for having
All
us.
right.